clinical examination of the respiratory system. Let's do with cough. Cough is a maneuver involving three phases. First, there is deep inspiration, then is followed by expiration against a closed glottis. Then the glottis suddenly opens with an explosive blast of air carrying with its respiratory secretions. The cough reflex is initiated by irritant receptors in the larynx and major airways, which are stimulated both by materials within the airway lumen, such as sputum, foreign bodies, or even inhaled irritants, and events in the airway walls, such as infection. So one must inquire about the duration of the cough. Long-standing cough may be due to tuberculosis, while a cough for 1 or 2 weeks duration may be due to common cold. Variability. So nocturnal cough may also occur. Likewise, daytime cough is variable in asthma, while a persistent cough of few weeks or months in a smoker should make you think of bronchial carcinoma. So if the cough is episodic, ask about precipitating factors such as inhalation of pollen, dust or cold air. Cough related to meals or lying down may be due to aspiration of esophageal contents. With unilateral vocal cord paralysis, as in recurrent laryngeal nerve palsy, for example, due to malignant intestinal invasion, the cough may be rather prolonged and has likened to the lowing of cattle, hence bovine cough. Laryngitis leads to a harsh, croupy cough. A weak cough occurs in bilateral vocal cord palsy, respiratory muscle weakness, severe illness of any cause, and when the cough causes pain.